Okay, so hello everybody. Welcome to our webinar this month. My name is Schonbach and I am a clinical psychologist and work here at SkinPick. And today we're going to be talking about some of the common myths and facts, myths and truths behind dermatillomania or skin picking disorder. Those are synonyms there. I use them interchangeably throughout the webinar, so not to get confused. And so today our webinar will probably be about 30-40 minutes, and we'll have time at the end for questions and answer, a Q&A period. So I really encourage you guys to write in any questions that you have throughout the webinar, write them in the chat, and then we'll go through them all together at the end of the presentation and really ask anything about relating to the webinar, something that reminds you of something, but also if you have any questions specifically about dermatillomania, specifically about skin picking, also feel free to ask. And then also I encourage you to stick around really until the end of the presentation, because I'll be giving a promo code at the end for a discount on subscribing to our program to SkinPick. So with that, let's get started. Okay, so let's just quick overview of what we're going to be talking about today. So I'm going to do something a little bit more interactive this time. We're going to be doing some live polling to see about what you guys think about myths and facts. Of really 10 common myths and facts that we hear all the time here at SkinPick from clients, from our community, and we'll go through some of those. We'll talk about why there are so many myths about skin picking disorder, or dermatillomania, like I said. It's also called excoriation disorder. And then we'll go over a few tips of how you can debunk mental health myths online, not just mental health, but specifically skin picking disorder, but in general also. So in general, guidelines, ideas, we'll conclude, and then, like I said, we'll do a Q&A. So again, write in any questions that you have in the chat, and we'll go through them all together. Okay, so let's get started. I want to start already with a poll. So let me know what you guys think. Is it a myth or a fact that skin picking disorder is just a bad habit or a phase that people can grow out of? Launch the poll. Anybody else? There's still a few people haven't answered. It's not mandatory to answer. It's just, I think, fun to interact with this. Anybody else? Oh, a few more answers. Anybody else? Anybody else? Okay. It is dropped. Okay. All right. I'm ending the poll. We'll see what everybody said, and I'll share the results. Okay. So this is really interesting. So I said skin picking disorder is just a bad habit or a phase that people grow out of. And 97%, so 28 out of 29 people said that's a myth. And one person actually said that it's a fact. So first of all, okay, I'll stop sharing. Let's see. Let's see. Slide, you can see. Okay, so the majority, the vast majority of you guys were right. It is a myth. So skin picking disorder, it is a recognized mental health condition, and it's characterized by recurrent, repeated, compulsive picking at the skin. And that has to lead, this is part of the criteria of the disorder, that it leads to significant distress and impairment in functioning, typically in people's day-to-day lives. So some people can experience a decrease in symptoms over time, spontaneously. However, for many people, it will persist if there isn't an appropriate intervention or treatment. So really, I think we can all agree, it's not merely a phase that somebody naturally outgrows, but rather it's a complex issue that often requires professional support for management and for recovery. So awesome. Most people were in agreement with this. Let's do another one. I hope you guys are okay with this because we have a bunch. Okay. Now, what do you guys think? Myth or fact? Dermatillomania or skin picking disorder is a rare condition. Give it another few seconds for everybody to answer that wants to answer. It's not, again, it's not mandatory, but it's nice to interact. Let's see. Oh, almost only one person hasn't answered yet. You want to answer? Okay, I'm ending the poll. And let's share the results. This is a little bit more split. This is interesting. You guys can see the results. So it's interesting. We had 25% of people saying yes, it's rare, and 75% saying no, it's not rare. That it's a so let's see. See? Okay, so yeah, so you can see here, it's a myth. It's actually a very common disorder, and prevalence of skin picking disorder, of exfoliation disorder, actually ranges between 1.2 to 5.4%. And just for a comparison, OCD, it has an estimated prevalence of 2 to 3%. So this is an upper limit of even higher. Again, I want to stress that these are estimates of the prevalence. It's really hard to nail down a specific percentage, and it varies throughout the literature, throughout the research. But this is really the reported statistics. But really, unfortunately, there's such a huge amount of stigma surrounding, in general, mental health disorders, but also specifically skin picking disorder. And then also, there really is a core element of shame, of a feeling of shame surrounding the picking behavior itself. And then that, first of all, prevents people from seeking help or from talking about it. And so really staying informed and learning about the disorder is really important and a really great first step. So things that you're doing already, like joining this webinar, or joining our community. So here at SkinPick, we have lots of different resources that can help with providing a sense of community and help normalize and help in reducing the shame in skin picking. So if you want to hear more about that, you can ask me at the end, but on our website, we have a blog and we have social media outlets that are really, these are all really good resources for information and for community. So if you want to hear more about that, definitely let me know. Okay, let's do another one. Then we'll see. Okay. So, myth or fact? Skin picking can happen all over the body. It happen just in one place, multiple places. Few more seconds. Skin picking can happen all over the body. Myth or fact? Okay, I'm going to close the poll. I'll share the results. Okay, you guys were all in agreement. This is a fact. Wonder if you guys are talking about this from experience, from knowing people, from you guys are very knowledgeable. It's good. So yes, this is definitely a fact. And oops, slide isn't showing. So yeah, so definitely skin picking can take place on any body part. And I wrote here, I found in the literature that some commonly reported picking areas are, first of all, the hands. So they said it's common. I don't have an exact statistic for that, but they say it's due to hangnails, due to skin abrasions around the side, very common. Arms, about 20% of people pick at their arms. An estimated 32% of people pick at their face. That's also very, very common. Around 17% focus on their legs. And then also pretty common, 22% of people pick at their scalp. So also, if you want to share your own experiences, you can write in the Q&A, but these are the statistics that I found from the literature. And I think we can just also see that it can happen at any place, and some places are more covered, some places are less covered. So also you might be walking around and seeing people that you don't know that they pick their skin, but it could just be that they cover it with long sleeves or on their legs and they wear long pants. So again, it varies between people. All right, this is a big one. Skin picking is a form of self-harm. Myth or fact? Few more people want to respond. What do you think? Skin picking is a form of self-harm. Anybody else? Okay, ending the poll. Wow, this was interesting. Let's share the results. You guys are very split. And I was wondering if this would happen because this is a controversial one. And this is a big, as I said it, this is a big statement. So skin picking is a form of self-harm. 57% of you guys said myth, whereas 43% said it's a fact. So you're fairly split. The majority said it's a myth, though. Stop sharing. See what's what. So it's a myth. So skin picking is not a form of self-harm. So let me explain this. So we have the DSM-5, or the Diagnostic and Statistic Manual, and that's really the book by which psychologists, psychiatrists, mental health professionals diagnose mental health disorders. And this has all of the classifications and all the specifications of every single disorder. So skin picking disorder specifically says that it cannot be diagnosed if the behavior is better explained by self-injury. So if it's with the intention of self-injury, we're not diagnosing skin picking disorder. So I want to highlight this. So the intent. So first of all, automatic picking, classify two different types of picking. We have automatic picking, and that's a type of picking that occurs outside of our awareness. So first of all, there's no intent there. That an example of that is you could be watching TV, mindlessly working, something like that, and then all of a sudden start picking at your skin. Okay? And that's, so there's no intent there of self-harm. And then the other type of picking that we classify is called focused picking. And that's where people, a lot of our clients kind of explain it as you get into kind of a trance and you can't get out of it. And then a lot of the times people report having a goal of like an accomplishment, like a sense of accomplishment. Yes, I did it, kind of. You might not feel good about it after, but it's like, it's the type of feeling that you feel some almost a reward and accomplishment by doing it. And this is in comparison to self-harm. So self-harm, there is a conscious goal or intent of pain. So again, let's talk about pain. So just underline this. So pain isn't something that drives picking. When you're picking your skin, you're not looking to cause yourself pain. However, for self-harm, that is the actual motivation. So that's the really big separation between these two disorders and these two behaviors. So it's interesting that people were so divided. Okay, let's do another poll. You guys are with me. Okay, so what do you guys think? Skin picking disorder is more common among females, myth or fact? Okay, a few more seconds. Most people answered. Okay, cool. Let's share the results. Okay, so the majority of you guys, 80%, think that that's a fact, that most skin picking disorder is more common among females. 20% though disagree. So maybe you think that it's equal, maybe you think it's more common among males. Let's see. So it's a fact. So skin picking has been found to be more common among females than in males. So a recent study, it's a meta-analysis. So essentially this is a study that analyzes different studies that are already published. And so this was conducted they took a population of adults from all around the world. So they found that the reported likelihood of females having skin picking disorder, that this reported likelihood is higher than males, and they actually found that it's 1.45 times more likely. So higher, so it's a lot higher. That being said, men are not immune. Men are not immune from skin picking disorder. So let's look at some gender differences. So in another study that I found, that they looked at university students, but they had a huge sample. They had almost 2,000 university students. So they did find gender differences between men and women with skin picking disorder. So they found that men with skin picking disorder had significantly higher BMI or body mass index ratings. So this means that they were more overweight compared to men who did not meet criteria for skin picking disorder. And those were considered more normally weighted on the distribution of body mass index. And then also they found, this was an interesting finding, is that men reportedly perceived themselves as significantly less attractive to others. And so they did this comparison between men and women who had skin picking disorder. And then for women with skin picking disorder, they found that women picked from significantly more diverse sites than the men did. So like we talked about, skin picking can happen in any part of the body. And then also they had higher depressive symptoms than men. So this is, first of all, interesting. So first of all, women typically report mental health disorders more than men. So I want to also say that in terms of the fact that there's a higher likelihood of women having skin picking disorder. But also we know that from literature that women tend to have more depressive symptoms than men. So also just stating that there. Okay, let's do another poll. What do you guys think? Skin picking can affect people of all ages, myth or fact? Anybody else? Okay, and then the poll, I'll share the results. Okay, so the vast majority of you guys thought it's a fact, and one person did think that it's a myth. See? So it's a fact. So skin picking does affect both children and adults. So the disorder actually has been found to be most common in childhood and adolescence and young adulthood. And so in a study that sampled actually adults with skin picking disorder, they asked about the age of their onset. And so they found two main groups, so two main age groups of age of onset of starting of skin picking disorder. And so the majority of the participants in the study actually began picking in adolescence at around 13 years old. And then another smaller group began actually skin picking in their mid-adulthood, in their early 40s. But this is just when picking begins. So it can affect children and adults throughout their lives. And like I said at the beginning, if it's untreated, it can persist for years. So really, what are these stats showing us? They show the importance of identifying and of treating the disorder, first of all, among children and adolescents, but in general, early on, close to onset, in order to prevent long-term suffering. And really, I also want to specify that there is, unfortunately, a big lack of research among the population of children and adolescents, specifically for skin picking. So really, there is a need for further research in this population, especially if we know that there is a majority of onset happens early on. So these are important things. Okay, we're nearing the end of our myth and fact polls. So let me know what you guys think. Myth or fact? Skin picking only affects those with poor hygiene. Anybody else? Okay, I'm ending the poll. And I'll share the results. Okay, wow. You guys are in consensus, complete consensus. Everybody thinks it's a myth. Okay, good. I'm happy. I feel like this also built on what we talked about earlier. But first of all, it's a myth. You're all right. But really, I was surprised to hear that this is such a common myth that it comes up a lot in blogs and online forums, in our community. But really, this myth, it speaks to the stigma surrounding the disorder. So people don't engage in picking behaviors because of a lack of cleanliness or a lack of motivation to care for themselves. really research shows that people with skin picking disorder, they have higher levels of anxiety, of stress, difficulty regulating emotion. And that's typically what drives the picking behaviors. And then also I want to emphasize the fact that it doesn't indicate an acne problem also. Because in many cases, a person begins picking at a point on their body that's barely visible. And then the hyper focus on that one spot leads the person to pick until this spot that's barely visible becomes a bleeding wound. So, like I said at the beginning, when we talked about the criteria, picking leads, first of all, to physical damage, physical skin damage, but it also leads to emotional and social difficulty. So that's part of the impairment that I talked about. And then really we like to think of this as a vicious cycle. So difficult emotions cause us to pick our skin. And this skin picking, it's a attempt to self-regulate or really to deal with these difficult emotions. It is an attempt, not a healthy attempt, but it is an attempt. And then it's a vicious cycle because we see that the picking, it actually leads to more difficult emotions. So it's just a vicious cycle that goes around and around. That the picking is kind of the core. But yeah, this is a myth for all of it. Okay, just a few more. So, myth or fact? If you have dermatillomania or skin picking disorder, it means you have OCD. Myth or fact? Give it a few more seconds. Okay. Interesting. See the results? You guys, oops, were way more split on this time. So if you have dermatillomania, you have OCD, 64% it's a myth, said it's a myth, 36 said it's a fact. So the majority said it's a myth, but there is a good chunk of you guys that think it's true. Let's see. So it is a myth. So let's talk about why, first of all, this is a myth and where this comes from. So first of all, again, going back to the DSM-5, the book that we use to diagnose mental health disorders. So skin picking is classified under something called obsessive compulsive and related disorders. So this family of disorders, it includes skin picking disorder, but also trichotillomania or hair pulling disorder, hoarding disorder, and also body dysmorphic disorder. And so let's talk about what's similar between these. So first of all, we like to think of OCD and skin picking disorder as they're kind of like cousins in this family of disorders. So what's similar between them is that they both involve repetitive behaviors. But then again, let's talk about the differences. And again, the difference is the underlying reason for the behavior. So let's talk about OCD. So in OCD, what happens, we'll say, I'll just explain it very, very briefly. It's a very, very complex disorder. But in OCD, the person has an unwanted thought, image, or urge, and that's the obsession. And that leads us to spike in distress. So it could be anxiety, it could be disgust, it could be fear, but a spike in distress. And then the person performs some repetitive behavior, which we call compulsion. And that behavior, that compulsion, the goal of it, again, we're talking about the underlying reason, is to relieve the distress. And then there's two kind of big elements to OCDs. First of all, there's this element, we call it, of magical thinking. So let's think about a classic example of OCD, could be hand washing, that could be the compulsion that you do as a result of an obsessive thought or what do you call it, an unwanted thought or image. So for example, picturing my child or my parent getting into an accident, and then I feel distress. Sorry, first let's start with that. First, I picture an image pops into my head of a loved one getting into an accident. I feel distress. I feel fear, and then if I have OCD, and then I could go and do a compulsion like hand washing to reduce the distress. And the element of magical thinking is that if I do this action, the event of the car accident won't happen. So there's this idea of magical thinking that what I do is has some influence on events in real life or of your personality or of different things. But it's the idea that there is some element of magical thinking between what I do and control over the world. And then also something very important to differentiate is that in OCD, the compulsions are unwanted. We call this ego dystonic behavior, just saying that it means that it's not a wanted behavior. And interestingly enough, with skin picking disorder, often people, it's so hard to get clients to stop doing it because they're used to it. They do it all the time, and they don't. Often people report not disliking the behavior, which is interesting. And then also I wanted to just talk a little bit about the treatment for skin picking versus OCD. So in OCD, we treat it with something specifically called exposure and response prevention, or ERP. And in this, you specifically expose the person to their obsessions, to the triggers that cause their obsessions. And then you ensure that the person doesn't respond by engaging in compulsion. So for example, with the example that I talked about, the image of the car accident, so I could sit with the client and we could write out an imaginary script and then have them read out loud the imaginary script of their family member getting into a car accident, and then not respond by washing their hands. And that's called exposure and response prevention. And then you do this in a hierarchy, and it's a very long process. However, with skin picking disorder, essentially what we do, I'm not gonna get into the details of the treatment, but essentially what we do is we find alternative behaviors to replace the picking. That's like the crux of the treatment. And then also just a word on medication, skin picking disorder doesn't respond to the same medication as OCD. So that's also kind of proof in showing that if there was some underlying biological not overlap, there is overlap because they're cousins, like I said, but if they were the same disorder, they'd respond to the same medication. Okay, 2 more. What do you guys think? Myth or fact? Oops. Myth or fact? Dermatillomania, or skin picking disorder, is a sign of mental weakness or instability. Okay, I'm gonna end the poll and show you results. Okay, interesting. So most people think it's a myth, but still some people think this is a fact. So let's see. So it's a myth. So dermatillomania, or skin picking disorder, is a recognized, like I said at the beginning, mental health condition. So it really arises, like I wrote here, from a complex interplay of genetic factors, environmental factors, and psychological factors. So research shows that there is certain areas, parts of the brain that are changed, that are different. And studies have shown that there is a genetic component to the disorder. You can see the heritability through different twin studies, and there's different genes that have been shown to potentially be implicated, things that are associated with serotonin, which is a brain chemical or a neurotransmitter, that have been shown to be implicated in skin picking disorder. And then environmental factors, so things like exposure to bullying, domestic violence, trauma, infections, birth complications. Those are all environmental factors that have some impact on skin picking disorder. And then psychological factors, so things like stress and anxiety, perfectionism, emotion regulation, like we talked about. So these are all things that together contribute to skin picking disorder, and show that it's not a sign of mental instability. It really is coming from a whole interplay of different factors. Okay, last poll. What do you guys think? Myth or fact? Skin picking disorder is treatable. Okay, open the poll. Show the results. So yeah, 90% of you guys think it's a fact, it is treatable, and 10% thought it's a myth. Interesting. So let's see. So it's a fact. So seeking professional help, like we said at the beginning, really can greatly improve outcomes. So unfortunately, it has been suggested, estimated, we don't actually know, but through literature, the research estimates that less than 20% or less than a fifth of patients, people with skin picking disorder, actually seek treatment for their skin picking. So it's thought that things like social embarrassment or the belief that the condition is just a bad habit, like we talked about, or again, the myth or the fact that it's untreatable, prevents people from seeking help. And then also, I read in a study that it's reported that often people who do seek treatment, they often first go to their general practitioner or their family doctor or to a dermatologist before consulting with a psychologist or a psychiatrist, which shows also the fact that people think that it's more of a biological condition or something medical. And mental health is medical also, but as opposed to strictly a mental health condition. So that's also I thought was really interesting. And so here I do want to talk in terms of treatment. So here at SkinPick, we offer an online, fully customizable therapy platform. And in this therapy platform, you're assigned an expert therapist, so therapists that have both the knowledge and the expertise and past experience treating this specific disorder. And we use two main types of treatment. So we use, first of all, HRT or habit reversal training. And that includes things like awareness training, competing response, stimulus control. And so these are all kind of big words that if you want to get into this, first of all, we have webinars on this on our website. You can look those up. But again, like I said, a main idea is helping to understand your own triggers and then to find replacement behaviors that are healthier to deal with uncomfortable emotions. And then in terms of the uncomfortable emotions, we use something called acceptance and commitment therapy, or ACT. And that really helps to deal with and understand the difficult emotions and urges that often lead to the picking behavior. Okay, so let's move on to just a little bit talking about why there are so many myths. So first of all, skin picking disorder, it's not as widely recognized or understood as other mental health conditions. So really this leads to a lack of awareness and leads to misinformation and myths about it. And we talked about this already. So there is still a big stigma around, first of all, mental health disorders in general, but specifically about shame surrounding skin picking. So people often don't want to talk about their struggles with skin picking disorder, and then the lack of communication about it leads to misconceptions about it. And like we said, Skin picking disorder is a complex condition. So there's a ton of different contributing factors, like we said, like genetics, environment, psychological factors. And then because it's so complex, it maybe can lead to more misunderstandings or myths. And then some people also might misinterpret the symptoms of their skin picking disorder as, like we said, like a bad habit or maybe a lack of self-control rather than a diagnosable mental health condition. That's what it is. And then also I just wrote media portrayals because I also think a lot of the time that the media has a hand in contributing to myths and misconceptions. I know in what's the movie? The Black Swan. There's a character there, the main character, she does skin picking. There's just a lot of not great portrayals of mental health conditions in general. And so I think that kind of doesn't accurately reflect the experiences of people with the disorder, and then it leads to more myths. Okay, so let's talk about a few tips of how you can debunk myths, mental health myths online. So first of all, number one thing that I think is important is to cross-reference, to look at the claims made by whoever, by looking at different sources. So look at medical journals, academic institutions like universities, government health organizations like World Health Organization, things like that. To evaluate the author credibility. So it's important to understand what's their expertise in mental health. You want to look for authors, people that are writing, that are qualified professionals, researchers, people with relevant experience in the field, not just, I don't know. And then this is also important is to be careful looking, if you're reading it and you see kind of sensationalist or alarmist language, often people tend to portray misinformation with dramatic or exaggerated claims. And they do this to grab your attention. We're in the world of AI and whatever. Very important to be careful of this. And then also this kind of goes along with this, but citations and evidence. So legitimate articles, they provide references to multiple studies, to expert opinions, and really a lack of citations could show that the information isn't based on any research. It's just maybe they made it up. Or they asked ChatGPT, I don't know. And also what I always say, when in doubt, really just seek advice from a licensed mental health professional. Because we're trained in this. We're trained in providing accurate information and guidance. And if I can't provide the specific one, I know who to consult with that I know who could give me the specific answer. So I think that's always a good thing. And then finally, personal anecdotes. Personal stories, really insightful, can be really helpful, but you shouldn't ever take a personal story or a personal anecdote as a universal truth. Really, it's important to verify the stories or the anecdotal evidence with research and to make sure that they're backed up. So these are just some tips that I think are helpful. Okay, so just to summarize and conclude, so we talked about 10 common myths and facts for skin picking disorder. So we talked about how that the fact that it's a bad habit, just a bad habit or a phase that people outgrow, that's a myth. That it's a rare condition, it's a myth. We showed that it's up to 5.4% of prevalence. We said that it's not the same as self-harm. We talked about the intent, the pain, the difference. We said that it's not a result of poor hygiene or an acne problem. We showed that it's not the same as OCD. They're cousins, we like to call them. They're under obsessive compulsive related disorders, but it's not the same. And we showed that it's not a result of a mental weakness or instability, but it's a result of a bunch of different factors, genetics, psychological factors, environment. Those all affect us and then can lead to skin picking disorder. We talked about why there's so many myths. So we talked about that there's a lack of awareness, stigma, there's the complexity again. People misinterpret their symptoms in the media. And then I gave you some tips on how you can debunk mental health myths online on your own and just be more of a critical consumer when you're on the web. I think it's important. Okay, so I'd like to thank you guys for joining. And first of all, again, I'm just going to talk about Skin Pick really quickly. Like I said, it's an online therapy platform, evidence-based therapy that really does work. You get an expert therapist specifically for skin picking disorder that guides you along the way. And you're doing this from the comfort of your own home, and it's a fraction of the cost of traditional therapy. And you want to know more about this, you can contact our customer support here with the email. And then here also, if you want $100 discount for the first month of subscription, you get a promo code of ProWeb100. So now I think we have some time for Q&A. So, okay, let's see. Okay, great. I used to think it was just a habit. So great. Definitely rare, yep. Okay, so not sure about anyone else, but sometimes I transfer my skin picking to my husband. I would pick his back. He says it doesn't work that way. So technically, in terms of the skin picking disorder, it is picking your own skin. That's actually very interesting. I hadn't thought about this, about picking others. Interesting. I could actually look into this. It's a very interesting area. Maybe I wonder if it's being researched. Yeah, so definitely scalp or ear picking. That's definitely one of the many body parts that it can be done. Yeah. I wonder what was the relief. Someone said I said it was a myth that skin picking disorder occurs in people of all ages because I don't think infants pick, so that would not be all ages. I was just asking the question, is there any research on that? So I actually did find that in the research it said that babies do pick their skin. It was written though that often subsides on its own, but that was documented in the literature, so that was interesting to read. Why would someone think that? I don't know what the question was, sorry. But we covered everything. Okay, so somebody asked, but skin picking also has an urge that leads to distress, so isn't it a subset of OCD in that case? So that's a great question. So that is why it's considered also part of the OCD, obsessive compulsive and related disorders, because it follows a similar mechanism. But again, the differences are the first of all, the repetitive unwanted thoughts or the obsessions that doesn't happen in skin picking disorder. And also the compulsions. First of all, it can be in OCD happens in a wide range of domains, we call them. And skin picking is specifically skin picking disorder. And like we talked about, the magical thinking, that's an important component of OCD. And you're right, it does fall. There is an urge that leads to distress, and then you pick the skin. So it is similar. We talked about the vicious cycle. We also talk about a vicious cycle in OCD. So you're right, there is a very similar mechanism, and that's why they're together in the related disorder family. I hope this last one is a fact, but I personally feel like it's a myth. Yeah. Again, like skin picking disorder, we can treat it, but we do need to manage expectations. It does take a lot of work, a lot of time, and often the symptoms are reduced. It's maybe not completely gone away, but it can help. Good question. Is skin picking coupled with a skin disorder like eczema able to be treated? Should it be combo treated with medicine, or which should come first? I would definitely consult a doctor about the eczema. That is important, but I think you should in parallel. I think they definitely go together. So I would definitely treat eczema because that is like a biological medical specific condition, but then I know that skin picking disorder can exacerbate it. So I would do them in parallel. Dermatillomania is a mental illness. Yes, it is a diagnosed mental health disorder. The next question was, I sought help on a few occasions over the past 10 years. I certainly felt I was more the expert than the professionals I saw. Unfortunately, that's a very common experience. Is there an extensive list of psychologists who specialize in practice in Alberta, Canada? Of expert psychologists in skin picking disorder, I'm not aware, but I can tell you that Skin Pick, we work with clients in Canada, and you can do it from home, and you'll get a therapist who will be with you throughout the way as an expert. Okay, there are a bunch of comments that I'm going to skip because we actually only have 2 more minutes. What is your recommendation for helping accept and move on after a skin picking episode or a lapse in absence from skin picking? So first of all, I like that you phrased it like that because there is an element of acceptance and we lapse. That's part of it. We call it, we have at the end of our program, we have a relapse prevention. I think a big thing is trying to understand what were your triggers. That's a big thing to do right away when you see what happened. And then always maybe to modify your environment around you. We call that stimulus control. Think what you can do instead of try to find replacement behaviors. And also recommend to sign up for Skin Pick. Next question, if OCD medications typically don't work on skin pick, are there medications that do? So there are, as of now, no FDA approved medications specifically for skin picking disorder. So that's our answer. My daughter's suffering from skin picking. How can I help her if she doesn't see it as a problem and it's not willing to cooperate? So we actually have a parent program. So you can sign up and as a parent and then work with your daughter through skin pick through our online program to help her with her skin picking. Okay. We'll do this question last. Is there any evidence that dermatillomania can be treated through hypnosis or hypnotherapy? I've not seen any research on this. I'm not aware of this. I'm not aware of this. I'll just leave it at that. Would it be possible to organize a webinar with somebody who's cured from skin picking? I've been struggling for 20 years and I have an impression it's untreatable. I'd love to hear from someone who cooperated with it. That's a great idea. I do believe that we have, I think on our website, if you look for past webinars, like somebody, I forget how it's what the title, but I believe that there is. And I'm really sorry, guys. I know you guys have a lot of great questions, but we do need to finish up. The cost of the program is $260 every 4 weeks, and the treatment takes, it's very variable. I do suggest though that you, if you have any more questions, do email us at support@skinpick.com. And we will get back to you. So thank you so much for joining us, and I hope that you have a good rest of your day. Bye, everybody.